maybe.
Whoever it is, they're intriguing.
Yes, they are.
So I cannot see that I'm recording.
It says recorded on mine.
Yeah.
Oh, it does. Oh,
Yeah,
good.
mine too.
All right. So, okay, I'm gonna go pet the cat.
It helps bring down the angst.
Cats are not allowed in this room.
Oh, well, that's a baby grand behind you.
Yeah.
Oh, do you play?
I used to, but it's my husband's piano. If he didn't play, I probably would. It's just one of those things like, I'm not going to touch it because there's like some really great musicians in this house. So.
Hello, everyone.
Hi, Chandra.
Hey, Chandra.
Hi, Chandra.
Hi.
How's it going?
It's going.
It's going. Yeah, that's it. That's always the key. It's as long as it's still going, it's all good.
That's true.
Yep, I'm trying to get caught up.
Here.
We have someone on the call is called Spicy is my middle name, and so far we're all intrigued. We still don't know who it is, but it's intriguing.
Who? Spicy is the middle name. Just to let you know, we're going to have some guests on the call today.
Oh, okay.
From the mental health nursing students.
Oh, no.
Okay. From Lakeview or from U of I?
U of I.
Okay.
Kimberly Simpson reached out.
I know Kim.
Yeah.
Yeah, she used to send those students to snowball retreats. They were very helpful.
Yeah. Kim is good people.
Well, I've made my traditional request for people to sign in the chat area with their agency affiliation, but we'll see what happens. Can you all hear the lawnmower next door?
I don't hear a thing.
Neither do I.
Oh, good. Okay. Hi, Tom.
Hello, everyone.
Hello.
How you doing?
Good.
Good, good.
That's Nicole from DSC.
She's Spicy is my middle name. That's cute.
Okay, Nicole.
Now we know.
Oh, I got, clever, huh?
That is.
Clever. We're not meeting anymore this month, are we?
I hope not.
Maybe the comment should be, I ain't meeting anymore this month.
That should be the comment, really.
Well, then you make sure you make the decision.
That's the plan.
Yes.
That's the plan.
Make the decision.
Hi, Stephanie.
Hi.
Hi. Hi, Chandra.
Hi, Stephanie. You don't like talking on the phone, do you?
No.
Okay.
She doesn't sound like she likes talking on Zoom either. So.
No.
Okay.
So did I hear Tom Moore talking about calling a special meeting at the end of May?
Yeah, right. Yeah.
Well, he was kidding.
In November.
Well, Joe can do that. Joe has the power to call a special meeting.
No, I do not want a special meeting.
Yeah.
No special meetings.
All right.
Oh, boy. I thought it was getting warmer, and then it turns out it ends up being chilly today.
I know. This weather, it's Illinois.
I guess. I also am getting too old for change, so that doesn't help either.
Mhm.
Joe, how's David doing?
He's doing much better. This was a much needed break.
Oh, okay.
So it's been good, and he was accepted to. He's going to start at uni in the fall.
Oh,
Okay.
good.
So
Cool.
he's going to be looking forward to that. It's a totally different environment from where he was.
Yeah.
So I think he will be good.
Hey, Chris.
Hey,
Good evening.
how's it going? What does that V stand for?
Oh, on my hat,
Yeah.
Las Vegas Golden Knights hockey team.
Oh, okay. It's kind of weird that Las Vegas has a ice hockey team.
They don't play outdoors, do they?
Not often.
Yeah, it's 100 degrees in Las Vegas in March.
This light is not right.
You need a good light, huh?
It's not good.
So Tom, I think did your son attend uni also?
Yes.
Okay.
Yeah. He wanted to play soccer, and he did.
Okay. So I don't know if David can play soccer now since he had that concussion.
Right, right.
So what he used to play soccer, played soccer with a little club around here for a couple of years.
Yeah. Well, then the classes started to get in the way. So
Mhm. I understand that.
I think he went in the 7th grade.
Yeah. And David is going in the 8th, which is good because I think the maturity would help him a little bit. Hey, he's my son. I mean,
Well, it helped us, and by the time he was 22, he was pretty mature.
yeah, as a young man, we don't mature very quickly.
No, we're not good at it.
Mhm.
Hey, I went to the dentist yesterday.
What happened?
Oh, you can get your teeth fixed now. I thought that was pretty interesting,
What was it like, Julian or Tom? I'm going in about a month.
Oh, okay. I couldn't go in. You have to call them, and then they come to the door, and then they let you in, and then they show you to the room, and they all wear masks, and they wear masks and gloves during the whole time. I can't remember if she had a shield on or not. I saw one there. I don't remember if she did or not, but and then when they finish, the dentist walks you to the front desk to make sure that everybody is not as close as. So there's no one there's no waiting room. There's no one waiting in the waiting room. And took her about an hour. They were all prepared, all ready, but other than the wearing masks they always wear gloves. Now that I think about it, they always. And there were very few people there. It was pretty much the way it was before.
Well, it'll be interesting. I'm,
Yeah.
course, it got postponed. And, so my wife and I got a call, I guess it was this morning.
Uh-huh.
And got scheduled. It's not till June 24th.
Okay.
So
I got in right away. You know, after that experience, I would think it would be easier and less dangerous getting a haircut than it would be going to the dentist. But because everyone can wear a mask and there's no, but the dentist is actually working in your mouth.
well, I think my dentist has worn gloves and a mask for a long time.
Even a mask?
Yeah.
Yeah, my dentist just wore a mask. Hi, Elaine.
Hello.
Hello.
I have a dental appointment tomorrow. Thanks so much.
Said I had my dental appointment just before, I think it was Thursday before this shelter at home.
Well, what's nice for me though is that during this being sequestered or whatever it is, I've been losing weight and my hair is growing longer. So it's a nice trade-off.
So you're not getting fat at home or something?
I don't know what's going on, but I look at my old pictures when I was in college. I look like then.
Okay. That's all good.
Well, you haven't seen the pictures.
I haven't seen pictures yet. Yeah, well, so you can always share the screen with us.
Yeah, right. Now,
There are 6 board members here, so you could start anytime you want to.
Okay. So
7 now.
7 now. So let's get going. Call to order. Stephanie, roll call, please.
Susan Fowler, Tom Moore,
Yeah.
Joe Omosagie,
Here.
Elaine Palencia,
Here.
Kyle Patterson,
Here.
Julian Rappaport,
Here.
Jane Sprandel,
Here.
Kathleen Worth Couch, John Paul Joachim.
Here.
Okay. Let's starting out with is there any citizen input today? Or let's jump right into it.
No
Any
hands
hands?
are up.
Okay. So move to approve the agenda.
So move.
Second.
Okay, all in favor?
Aye.
Aye.
Aye. Okay. So, I mean, pretty much the comments I want to make is just, as we've gone through this process, a lot of us who have been in the community have a lot of projects and a lot of agencies that we care about, and we want them to get as much funding as they can, and there's only so much money to go around. Looking at, what the staff has done, I think they've done an admirable job trying to make sure that all parts of all the different agencies got pretty much most of what they were asking for, and let's hammer out the rest and see where we can go. As of right now, we don't know what next year is going to bring, and so we know what this year is, so let's deal with this year and go from there. Lynn, do you have anything you want to add?
I do want to let you know, so right now, I'm not sure if in June, the governor's order will support us doing a fully virtual meeting. We may need to have a majority of the board in the Lal Shields room and then some on Zoom. And I know that the county board has conducted a few meetings that way. There are some technical problems with the microphones that they're working through those things. So it could be quite smooth. I don't know, we may still be able to do the June meeting virtually. If you get through all of the funding decisions today, what I had hoped to bring to you in June are updates on a number of different things that you do other than agency funding in order to set the stage for the budget process. I actually developed a budget for 2021 back in April, and I shared it with the officers. And so yesterday I had an opportunity to talk to the county's deputy of finance about the numbers that I've been using in that budget, and she confirmed that the numbers I'm using continue to be appropriate. She also, so what I developed in April is probably what I'm going to show you in June, but not ask you for any approvals quite yet. The county budget process is a little quicker this year, or it's, deadlines are a little earlier this year. So the county executive will see it before you actually approve it. So that's a little, but I'll let them know that it's not been approved by y'all yet, because I would ask you that in July. So the other thing I learned that was important is that the treasurer does not expect the first tax revenue distribution to be late this year. And you remember last year it was a few weeks late, and the mental health board was able to pay all of its obligations on time, but the CD board was not quite. They didn't have quite enough money in the fund balance. So it was good to check with her. It was also an important project. Chris Wilson helped me quite a bit, to figure out what we actually have available. And so I'm glad to know that we'll probably have some of the 2020 revenue in June. The bad news is no one can really predict what the rate of collection will be. In the past, we've been able to plan for 99% collection of the billed taxes, and we get around 99.5%, but this year, no one really knows. So I wanted to thank you all, including the staff, for helping me, because early on, and when we had to scatter to the winds as a result of the pandemic, I thought the one thing that we can do, that we have control over, is the funding decisions. Even though you're making decisions in the dark right now, at least we can do it on time. And so if we've ever thought about emergency funding, I think right now is the emergency. And so that was the frame that we've been sort of operating in the last couple of months. And I want to thank all of you for so much support for that. It's my opinion that if we can keep the agency programs that we value operating, like without an interruption in payment, that's great. And meanwhile, we have to wait to see what's going to happen with the state or with federal opportunities, and the huge increase in mental health calls that are already being seen across the country. That's all for future discussion. Anyway, so that's all. Thank you.
You're muted, Joe.
Okay. Wonder why I was muted. Okay, so let's get into it. Let's start looking at the decision memorandum, the spreadsheet, and if you have any questions, we can go at it one by one and try to do as much as we can today. Is that okay?
So I made a number of changes in the document from what you discussed last week, but I did not capture a whole bunch of the ideas that you were all talking about. The highlights that I put into the document didn't copy very well, so Stephanie went through all the board packets and re-highlighted for us.
In pink.
Isn't that nice? So people looking at the board packet online can see the yellow highlights, but we all have pink highlights.
Thanks, Steph.
If that's helpful.
Thank you, Stephanie. That's a lot of work.
It was nice.
So the first change was the date, and the date, that's fine. So, part of, I mean, since this is a new process for me in this position, how do you want to go about it? Do you want to speak out specific things and discuss it, or just carte blanche and?
Well, what's our task that's different than what we did last week?
Our task is to now make say this amount of money will go to this agency or that agency.
So last week you were looking at a draft of some decisions, and I didn't change those motions. There are a few changes. You know, there were two things I had recommended you defer, but took those out of the deferral idea. And there are things like that throughout. So now you have to spend some money.
Yes, that's what we're doing, spending money. And we have the money. Based on it, we might be over about 60, but we probably will still have the capacity to fund pretty much all the agencies. Maybe not at exact.
Joe, Julian has his hand up.
Okay, good, Julian.
So maybe I'm misreading what you did, Lynn, but it looked to me like you basically left things the way they were, except for minor things that, you know, you're fixing a few little mistakes here and there. So what I would conclude is that you were not persuaded by any of the conversation we had to change anything from what was originally proposed. Is that a fair assessment?
Well, I do not have a vote.
Mm-hmm.
And I could give you an opinion, but I think it's important for you all to be able to make the decision. I did spend a lot of time trying to figure out if any additional expenditures were affordable. You can see that I'm already proposing that you spend more than I see in the budget, and that was the reason that I wanted to look really closely at the numbers. And so we have probably underestimated how much money is going to come back to us soon in the form of excess revenue from agencies. So for 2020, you're fine. So you could spend more. And you know, the worst case scenario is that come 2021, at this time, the decisions might be a lot harder. That's the worst case scenario. So is that helpful?
Yeah, I mean, it is helpful because I think, so your group, your team looked at the numbers, and part of what we were trying to do last week was to just talk about how those numbers, even the numbers work out for all of us. I know John talked about 1% cut here, and Julian talked about, well, this agency needs more. So that's what we're trying to do here. We're trying to come up with what's going to be best for our community. And really when it comes down to it, all these agencies seem to deserve the money they're asking for. So it's now how much are we going to make a difference in what we allocate. So Julian, does that answer your question in any way?
Well, I guess what I'm looking for is some discussion about the things that we went over in some detail. I didn't hear any, apparently Lynn didn't think we made any decisions.
So we're making decisions today.
So, I mean,
if
I were writing this budget based on the conversation we had last time, I would have made some changes that Lynn didn't make.
Right.
Okay.
I didn't make them because I needed to deliver you a document the next day. I only had one day, and I was not able to get any information about the funds until Monday. So I couldn't say with any confidence in this document, which is, it's my responsibility as your staff to give you, a degree of confidence. I think I am saying to you that since I got the information on Monday, I'm a little bit more comfortable with what you had suggested of adding some funding to 1 or 2 programs that really do seem to meet all of the parameters that people seem to agree on. You all had lots and lots of ideas, and there wasn't, like, even after the meeting when I talked to people individually, there wasn't really gelling around anything other than the one you brought up.
So Jane has her hand raised and
Nope.
Kyle has his hand raised.
Jane first and Kyle.
Okay, so I'm still gonna stand behind my plea that we need to support the underdogs. But with that said, I recognize we only have so much money, and we have to also look at what programs are gonna have the most effect on our community. We've really talked about the, I think it falls under the behavioral health supports, which reduce incarceration. I mean, I think that was an area we had an increase in money, and we see there's still a very huge need to that. So I will always stand behind my underdogs, but I also have to recognize money only goes so far.
Thank you. Kyle?
Lynn, you mentioned that we may have underestimated how much revenue is available. Do you know how much?
So the underestimate is, in this year's budget, I had estimated $50,000 of excess revenue. It's actually miscellaneous revenue, but it includes some of the excess revenue that gets returned. Chris may be able to provide a clearer explanation of this. Depending on when excess revenue comes back, it gets into that line or it doesn't. But other things go into that line, like if I get reimbursed by other associations for going to things. So it's a little bit of a catch-all. So 50,000 for all that stuff, but it looks like just returns of excess revenue from agencies will exceed that amount. So that's where the biggest underestimate is. And it's not, I'm very concerned about like not counting it until it's in the bank, but I can say that I believe that there will be more money.
Okay.
That's the other problem, is you don't have it yet. So I hate to say, oh, here it comes,
Yeah, I mean, and it's better to do that. I mean, since I've had to hatch chickens, I know you get some roosters.
Yeah.
So,
Well, I think that, does anybody have any changes they want to have made?
okay.
Yes.
And to Kyle's point, I would not, for me, I would not have us worry about what money we may be getting back and not getting back. I don't think that's a good idea to balance the future on some speculation. So if we get some money back, that's great. Figure out what we'll do together. But right now, do we have any changes that we want to make to this document that our executive director has given us?
Chandra must not be paying attention to me because I raised my hand.
Oh, okay. Go ahead, Julian.
She's been great at it up until that moment.
Just that moment.
Just that moment.
Okay, go ahead, Julian.
So, I mean, I guess it's not a secret that last week I was very worried about the healthcare consumers budget and their ability to continue doing the kind of work that they do in this community. I think that their request relative to our total budget is modest, and for them, it's going to make a huge difference in what they can do. I think they have a great record. So I would propose that we would take a shot at giving them the money they say they need to do their job, which amounts to what? How much exactly is it, Lynn? I don't know the exact number. $40,000, something like that.
Yeah, it's
Between
under
the
that.
programs.
So in the first, the priority for behavioral health supports, which reduce incarceration, that one, the difference is 20,365. And then in the next priority, innovative practices and access to behavioral health services, that's where the other application is. And that is different by 18,660. So it is less than 40,000. Yeah.
So I guess in answer to Tom's question, I would put that on the table as something for us to pay attention to.
That's the major change you would like to see across. I mean, if there's any change at all, that's the change you're looking at. Julian?
Yeah.
Okay.
Is that a motion?
It's not been put as a motion yet. It's not a motion yet. So let's keep discussing and we'll decide. And Julian can move it as a motion.
If I can say, just, I'm putting it out. I made the best case I could make for it. And I don't want to turn this into some tug of war. So what I'd like to do is just get a sense of other board members' feelings about it and see if we have a consensus.
Yeah.
I don't want to jam it down anybody's throat. I just think it's a good thing to pay attention to.
Yeah.
So I'm welcoming to hear what people have to say about it.
Kyle has his hand raised.
Go ahead, Kyle.
It seems like the best process would be, we have a decision section that has about 7 different motions, and the different programs we're funding are split up into several different categories, and they're each a motion. So if there are programs that people want to amend, is my voice echoing?
Yeah,
Yeah.
yeah.
Is there a solution to that, or
I'm
should I
trying to
withdraw?
figure it out. I can't figure out how that is happening. My hope is that the board members could be unmuted so you can have a conversation and all the rest of us be muted, but that didn't work.
I think everybody who's not speaking should probably just manually mute, and then when they want to speak, just click it.
Okay.
Anyways, I lost my train of thought. So I think that if there's a specific program that any board members want to amend the funding level, when we do the motion and then have the debate over whatever section it falls into, that would be the time to put forward an amendment to change that budget, and then we'd vote on the amendment, then we'd vote on the overall motion. And to Julian's point, I wasn't able to attend last week, but I feel I have the same feelings about the healthcare consumers funding. I think that I heard the arguments about for new programs not increasing funding until like an audit's received. And I think for healthcare consumers, it's kind of a unique situation where they've been around for over 40 years. And I think that, I mean, it's not super common to see completely localized social service entities exist for that long. And I think it speaks to their ability financially and with programs. And I hate just people just constantly say now more than ever on the news. It gets kind of cliche and annoying, but what they're doing now more than ever is extremely vital. And I think that I definitely would support amending the recommendations to increase back to their requested level, which I think is about 39,000. But yeah, I think the process would be though for somebody to do a motion for, actually I move to approve Champaign County Mental Health Board funding as recommended for behavioral health supports, which reduce incarceration subject to the caveats as presented in this memorandum. Is there a second?
Second.
So all in favor?
Well,
Well, we got to, it's got to be, since it's money, we got to do it. Okay, go ahead.
Debate. And so I would move to amend the recommendations to restore the Champaign County Healthcare Consumers Community Health Worker Outreach, or Community Health Worker for Justice program to its fully requested amount. Need a second?
I'll second.
Okay, let's discuss. Elaine?
I wrote to Lynn about this after the last meeting because I agree with Kyle that this is a kind of a unique situation. This is not an unknown agency, but I want to add something else about the way we're discussing things. I'm made uncomfortable by words like underdog because big agencies can do things small agencies can't, and vice versa. And I think to use adversarial language, which is emotional and not rational, it's troubling to me. It was done last week also, but I don't think we should vote for something because it's an underdog. You know, that's neither here nor there, really. We're voting for quality in service. So I just want to make that caveat. But as far as this program goes, I'm very much in favor of giving them the money, the healthcare consumers, the money that they ask for.
Thanks, Elaine.
Jane has her hand raised.
Go ahead, Jane.
Okay, so I support what Kyle was saying about amending the amount on that. In your opinion, were you going to cut money somewhere else, or just would this be hoping that the budget comes through?
Ben, could you speak to the just overall fund balance? I mean, I know you mentioned that there's 50,000 that you anticipated, but which could be a little bit higher. But what is the overall fund balance?
You can do, I can look for that email. There's the fund balance that you have right now will allow for this. It's, in theory, it would be good to have 6 months available at any time of the year. This is the lowest point the budget ever gets, and there's not 6 months available, but there's 3 months available. So you can afford to do a little bit more. It's just, and these are special times. So,
right.
And also, I believe that within the 2020 budget, I believe that our excess revenue will come in to the point where you can afford this. And then the question is just about affordability next year.
Right. Well, I just didn't want to assume that we were going on that philosophy where if I switch the page, Kyle's like, we're going to cut, $45,000 from here. Okay, so perfect. Thank you.
Okay, thank you.
I will say, as far as my intentions on amending programs, there's also the healthcare consumers other program is under a different category, but I didn't have any others that I intended to change, but I don't know if anybody else had any they're interested in.
Joe, Tom had his hand raised.
Hey, go ahead, Tom. Thank you.
Unmute yourself, Tom.
I can't find my raise your hand button, but the issue for me is the process here. It's like if there's a bunch of programs that are going to be amended, we should probably know all of them before because if we end up amending them one by one, we may end up with those who are first approved get amended, and then we find ourselves near the end with not money left to give. So I think I would like to know if this is all, then this is not a problem. But if we have more than just one agency that's going to be amended, we should probably know that before we make a decision about what to do with that stuff.
Thank you, Tom. That's really good. So just putting it all on the table and say, are there any other amendments or other agencies that we're talking about here?
There are no hand raised that I see.
Okay.
Okay, then let's just move on then. That seems like that's the only one we're going to deal with. That's so the problem I'm anticipating doesn't exist. So let's just move on.
It's better to have a problem that doesn't exist. Okay. So going back to, do we now make a motion to amend?
Well, I already did that in,
Okay.
I think John's second. So if discussion's over, we would vote.
So voice vote, I mean, individual?
I think it has to be a roll call. I'm
Roll
not
call.
positive.
Okay.
I'm sorry, for the amendment, I don't think we need a roll call, but for the once it's amended, we'll have to vote on the motion as amended, and I think that's going to require a roll call.
I am not very familiar with this Robert stuff, so.
So you do a voice vote now on the amendment, right? And then if the amendment passes, then you do a roll call. Is that what you meant, Kyle? Is that what you said?
Yeah, I think that would be the right way to do it.
Okay.
I wouldn't know.
Okay, so.
When there's money involved, you have to have a roll call. So
Yeah.
I think Stephanie knows what we're supposed to do.
that's all.
So.
Just a voice vote on the amendment
Mm-hmm,
Kyle just did
mm-hmm.
to add the full funding for healthcare consumers for their Justice Initiative Services Program, which is an increase of $20,365.
Mm-hmm. Yeah.
You can ask for a voice vote on that.
Okay. So who's
Are we
moving?
doing them one at a time then? Is that
Yeah.
I think we should.
okay?
Yeah, we should.
Fine.
Okay. Kyle, would you like to say it again, please?
What's that?
Would you like to move it again? Move the motion as you.
Yeah, yeah, the motion was to restore or to increase the Champaign County healthcare consumers community outreach, our community health worker outreach and benefit enrollment. Wait, am I reading the right one? No, I'm not.
You're on the second one.
Pretend that didn't happen. This is to increase the Champaign County healthcare consumers justice involved community health worker services and benefits program to the full requested amount of $75,140. And then John had previously seconded that.
Okay.
So if there's no more discussion, we would have a voice vote.
Okay. We just voice vote now. All in favor?
Aye.
All right.
Aye.
Just making sure that you're there. And so moving on, we've got that.
All those opposed?
Oh, did not hear any oppositions. Okay. So do you want to, let's move on and then we'll come back to the next one, or we just want to make sure we do all healthcare consumers right now?
Yes.
I think,
You have a motion on the floor.
yeah, we need to vote on the motion on the floor
Okay.
for the overall decision memorandum for behavioral health supports, which reduce incarceration.
Okay. Stephanie?
Before I start, Lynn, can you tell if Susan Fowler or Kathleen Worth Couch joined the meeting? They'd probably answer me if they were here, I guess, huh?
Yeah, they're not on.
Okay.
Kathleen was having problems with her Wi-Fi.
And some people are on as phone numbers. I'm not exactly sure who they are, so I'm glad you asked anyway, but I think they're not.
Okay, I'm gonna do the roll call now. Tom Moore,
Yes.
Joe Omoasagie,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Julian Rappaport,
Yes.
Jane Sprandel,
Yes.
John Paul Joachim.
Yes.
Okay. So be it. So move on to the, you want to make a motion for the other part of healthcare consumers, or we just, are there any other topics for discussion?
Well, it would be logical to make that motion now, would it not?
I think so.
Could we, are you going to do?
Elaine has a hand up.
I'm trying to remember, but I think the last year we voted by categories.
Right.
So I think that
Right.
maybe the better thing to do would be to finish the behavioral health support, you know, what the category we're in now, and then move on to other categories. Otherwise, we're going to be here till midnight picking and choosing and wandering around. And so if there's no, I think you determined that there's no intent to change any of the others, so we could vote by categories pretty efficiently. So I just suggest that.
I like that.
So did I misunderstand what we wanted to do?
No, what we're going to do, or I think what we're trying to do is vote by categories. And so we're doing behavioral health, and we'll do the other. Just
I mean, about healthcare consumers.
no, nothing has changed about that. When we get to the next, because they have two grants that they're looking at.
Are they in separate categories?
In separate categories, yes.
Oh, I see. Okay, they were. I'm looking at them together, so I didn't realize they were in separate categories.
They just happen to be in the very next priority category.
Mm-hmm. That's why.
Okay, fine. Thank you.
If you do, so if you are comfortable with the process you just did, it would apply to this priority too, the way you just did it.
Okay.
So do we just approve behavioral health supports?
Yes,
And then now we're moving on to innovative practices.
correct,
And then we'll go to systems of care,
correct.
following by collaboration. And then special, okay,
Yes.
Correct.
okay.
Correct,
So
sir.
let's go on to the next one, innovative stuff.
Yeah.
Okay.
Innovative practices.
So do we need to do the healthcare consumers here?
Yes.
No, we already had a motion for that, and that's already passed, right?
I thought we only did it for the first one.
Yeah. This
Is a second contract for them, so we need
So
to
what's
do
the
it for
second one?
that.
So you might do what you did for the first priority, which was Kyle made the motion to just as it's written here, and
Right.
Elaine seconded, and then immediately the amendment came up and you had a chance to discuss it.
Mhm.
But that process would work here too.
Okay, let's do that then.
Okay.
Second.
There a first?
It sounded like a motion to me, Tom.
I'll make the motion. A motion to approve the Champaign County Mental Health Board funding as recommended for innovative practices and access to behavioral health services, subject to the caveats as presented in this memorandum.
Second.
Okay. So we'll start with all in favor, then is there any discussion really before we go there? Or we beat the dead horse?
We're getting ready to.
To beat the dead horse?
Yeah.
Kyle has his hand raised.
Go ahead, Kyle.
I will move to amend the Champaign County Healthcare Consumers Community Health Worker Outreach and Benefit Enrollment Program to the original requested amount of $77,960.
Second that.
All in favor?
Aye.
Aye.
Motion approved. So discussion, technically.
Yeah, I think we discussed it
From the
already.
doctor, yeah, okay.
Moving on, as they say.
We discussed. Okay, so Stephanie?
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Julian Rappaport,
Yes.
James Brandel,
Yes.
John Paul Joachim,
Yes.
Tom Moore,
Yes.
Joe Omowasagie.
Yes.
Motion passed.
Okay. Innovative practices, are there any questions apart from healthcare consumers?
There are no hands raised.
Okay. So we move on to the next category.
We haven't approved this whole category, have we?
Oh.
We haven't
Yeah,
voted
you
on-
approved it with the voice vote.
By approving that amendment, we approved the whole category.
Well, you did a voice vote to approve the amendment, and then you did a roll call approving.
Yeah, I thought that amendment was just to the one thing, but you meant that
Yeah.
in the category. Okay,
The
thank you.
category.
Got it.
No wonder the Congress doesn't work.
I missed who seconded it, but I can watch the recording.
Okay.
Thank you. So you're ready for the system of care category.
Mhm.
I move that we approve the Champaign County Mental Health Board funding as recommended for system of care for children, youth, families, subject to the caveats as presented in this amendment, in this memorandum.
I second.
So John seconded.
Mhm.
Discussion?
There are no hands raised.
Let me give them 30 more seconds to see. Still no hands?
No hands.
Okay. So, all in favor?
For this, do we have to do a roll call?
We need a roll call.
Okay, roll call.
Kyle Patterson,
Yes.
Julian Rappaport,
Yes.
James Brandel,
Yes.
John Paul Joachim,
Yes.
Tom Moore,
Yes.
Elaine Palencia,
Yes.
Joe Omowasagie.
Yes.
Motion passed.
So, collaboration with CCMHB.
Joe, could I make a
Yeah, go ahead, please.
quickly? Because this is split funding, because a piece of this would be paid by the DD board and then the rest of it by the mental health board, I think it's good to tell you that the DD board met this morning and agreed to pay for their proposed portion of this and they were also hopeful that you would support this, and if you make a different decision, then they want to talk about these programs again. I think it was an endorsement of the programs.
Okay, thank you for letting us know. So, are there any differing opinions, ideas about this?
There appear to be no hands raised.
No hands again?
Mm-mm.
We need a motion.
We need a motion. Okay. So who's going to make a motion? Come on now.
Fine. I
Elaine
will.
said she would.
Make a motion.
I move that we approve the the funding as recommended for collaboration with the CCDDB for the I/DD programs.
Second.
Okay. So we're moving wide. Okay, let's.
There are no hands raised, so you can go on with the voice vote.
Okay. So let's go with the vote now. Roll call first.
The roll call. I'm sorry.
Jane Sprandel,
Yes.
John Paul Joachim,
Yes.
Tom Moore,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Julian Rappaport,
Yes.
Joe Omosagie,
Yes.
Motion is passed.
Okay.
Well, you have spent the money, and now the special, these are sort of, the first one is standard. We ask for this every year. We've tried to provide as much information as we can about what those contract negotiations would look like, just listing in the memo itself what we're thinking about. And then the other two are, one is the special notification that we also include each year, and this year it might actually be really important, which is the reduction if there is a significant shortfall in revenues for either our 2020 or 2021 revenues, that we would look at reductions to contracts. We haven't had to do that in a long time, so fingers crossed. And then the last one is about redirecting effort within these contracts, with the recognition that you've all along noted that these applications were written in January in a very different time, and that we may see the need to redirect some of the contracts towards different services by the same provider, or adjustments within a type of service. So those would be, we haven't done a lot of that. And I think that we would bring those to you like the other contract amendments that we bring to you, because that would be important to know. So anyway, so you're not spending any more money with these three, but they do have money implications. So I'm not sure if we usually do a roll call for these three. You know, Stephanie?
Do not know.
No, we don't usually, but we can if you want.
Maybe because money is involved, it would, Kyle says no.
We're not spending anything.
I think it's more if something is like directly moving money, then that would need whether we're approving. I mean, yeah, I think that I don't know. I mean, this is all old timey nonsense, and we're just making it up as we go. So hear ye or something.
Do we need a motion for contract negotiations?
We do.
Okay, I move to authorize the executive director to conduct contract negotiations as specified in this memorandum.
I second that motion.
All in favor?
Aye.
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 Your motion passed.
Thank you.
We need another motion here.
Mhm.
I do.
So I move to authorize the executive director to implement contract maximum reductions as described in the special notification concerning PY 2021 awards sections of this memorandum.
Second.
All in favor?
Aye.
Aye.
All right.
I don't think anybody opposed.
Nobody opposed.
Okay. So your motion is passed.
Thank you. And the last one? Who's going to move?
Tom, you're on a roll.
I can do it. I move to approve the motion to authorize the executive director to include all new PY 2021 contracts and to amend PY 2020 contracts with extended terms through PY 2021 to include the COVID-19 special provision described in the special notifications concerning PY 2021 award section of this memorandum.
Second.
Okay. All in favor?
Vote.
There's discussion.
Discussion. Man, I always want to forget discussion.
Kyle has his hand raised.
Go ahead, Kyle.
Lynn, can you speak to, I mean, is this directly related to what you were discussing earlier, or is this different? Can you just speak to what, so obviously this is new. I don't know if you wanted to elaborate on it.
Well, I'm not sure what I said earlier. So, which thing? I guess, okay, the purpose of doing this, and we've actually had language like this in the past, where if it were a sector or a service type that was about to change a lot because of maybe the state of Illinois was doing system redesign a few years ago. So we had some language about redirection of effort in some contracts. It was mostly DD stuff. So it's not unheard of to do this, but what it means is that we're acknowledging that the services the agency has promised to deliver may not be practical right now because of COVID-19. And there may be a better way for them to deliver the services, or they might need to move the focus to a different service need, because things are, sure, mental health needs are increasing, but there are also some emerging needs. So we wanted to make sure that the board has the flexibility and the agencies have the flexibility to respond to these changing needs as we understand them. And right now, we don't even know enough about like how things have already changed and what's gonna continue, right? Like, I mean, that's at least my perspective on the field, and I don't work in the field, so I might be wrong. The agencies might know right now what they need to do differently, and if we can capture it during the contract negotiations, we will, certainly share that with the board as soon as we know. But I think that we might just be surprised, like, what if 9 months from now we're still living in this kind of, shelter in place world where some people are not doing very well, and there's a way to provide counseling that we've never heard of before. I think the purpose of this is just to give you and the agencies some space to do the right thing when it's time. Does that sound possible?
Yeah.
Just for flexibility if we need it. Yeah.
Sure.
I think it might actually be hard to implement, but we want to make sure like we at least allow for something like this. We'll find out when we get there.
Yeah. I mean, looking at what has happened over the last 200 days of this year, the first 90 days were great, and the next 110 days we just don't seem to know what's going on.
I think the example that people that might be most front of mind for many of you is what's going to happen with positive youth programming that's been so important in the summer, and you've funded a lot of that. Those are some really great prevention and health promotion programs.
Yes.
It's not clear how those are going to be done if people can't gather in large groups. But there, people are working on it. Those conversations are happening, so I've got my fingers crossed that we'll have some breakthroughs.
Yeah, because I've been in places like the Boys and Girls Club, and I know we don't sponsor the park districts, but I know Urbana Park District is pretty much closed till July 31st or something like that. So we would have to deal with a lot of those different things that will be happening.
Do we need to vote here?
Do we need to vote?
Yes.
Okay. It's a roll call or voice?
Voice.
All in favor?
Aye.
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 I don't think anybody said no.
Nope. It's all good. So moving on. Do we have any agency information?
If any agency has any information they would like to share, you can raise your hand and we will call on you in the order that you raise your hand. Sarah LaGoyan has her hand raised.
Okay. Go ahead, Sarah.
Hey guys, it's Sarah from Macy, and just to follow up on what Lynn mentioned about summer programs and creative ways, we're planning to reopen for summer day camp mid-June, and we're going to do small groups of 8 kids, 2 staff, hoping to do several locations throughout the community to serve as many essential workers and low-income families that we can. So it's not going to be the same, and we're not going to be able to serve as many families this summer, but that's one way we're working towards it. Just wanted to give you that update.
Thank you, Sarah.
Adelaide has her hand raised.
Adelaide, go ahead.
Lynn mentioned a couple of minutes ago that some agencies may already know how this pandemic is affecting our community. So when I wrote my application last January, we had a waiting list of 25 people, which, one new counselor can take up that slack. We are getting on the order of 7 requests a week from new counseling. So I know it's been mentioned here that mental health is going to be the second pandemic, and it's already starting. There's going to be a huge need for therapy services in the future.
Should I say thanks? Thanks, Adelaide.
Sarah's hand is still raised. Did you have something else, Sarah?
No, I think I just didn't put it down. Sorry.
Oh, that's okay.
Okay. Is there anyone else? Any other agency?
I do not see any other hands raised.
Okay. Thank you for sharing.
Mm-hmm.
The schedule of allocation process. It's already, you have it in your schedules, you could see it. Do you have any questions about the schedules and allocations and timeline?
I hope you all aren't tired of having meetings. I hope that we can all make it to the June meeting, whether it's on Zoom or in person, and then that we won't be too tired in case you know, there are a lot of changes that we need to tell you about throughout the year.
Let's hope so. Let's hope so. I know you already gave us some of us DD board information. Is there anything else to add?
Just they did meet this morning, and the primary purpose was to spend the money. And there's a spreadsheet in your board packet showing this was what was recommended for them to do, and they did approve all of this. So
Okay.
we're on track to start working on contracts.
Sounds good. Sounds good. So the approval of board meetings for previous board meetings on pages 37 to 43.
Need a motion to approve.
And we want to move to approve. Do you see anything that needs to be changed, or?
I move to approve the Champaign County Mental Health Board minutes of April 22nd, April 29th, and May 13th.
Okay. A second, please.
Second.
Thank you, Tom. Voice vote?
Yep.
All in favor?
Aye.
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 Looks like no one is opposed.
No opposition. That's a good thing. Staff reports. Apart from, you guys have been working hard, so it's all good. Board to board. Who's been going anywhere?
Kyle has his hand raised.
Kyle.
Joe.
Yes, go ahead, Kyle.
I guess I just want to take a second to recognize the staff for getting us through another application process. I know that it is very difficult and complicated, and particularly right now, there's a lot of uncertainty. Obviously, there's some question marks as far as where things lie within some county offices financially, and now there's a lot of question on what the financial impact of all of this is going to be, and the obvious impact it's going to have on our programs. And I just want to thank you guys for the labor that you put in. It is recognized.
Yes, I appreciate you all. Thank you very much.
That probably doesn't require a second, but I absolutely second it.
And if it needs a third, you got me for third. That's true. So, looks like we're just about done here. It was kind of painless, wasn't it? So expenditure list, you see it at the back there. Any announcements?
I think we need to have action to accept the expenditures.
Oh, okay. I just wanted to go. I'm home already.
Here's where we could really make some trouble if we start voting no on the expenditure list.
Well, this
It's already been paid.
great
Already taken care of.
question, because you have all of us on the I think everybody's here. So if you had any questions, we might be able to handle it.
No, I was just joking. Sorry.
I was just saying that I wish I could have taken one of your classes to see how you run your class.
So should we?
Yes.
We need a motion for that.
We need a motion for this one.
Right. So I'll make a motion that we, what is it?
Approve.
We receive or approve?
Approve.
We approve the expenditure list as presented in this
Package.
package. Thank you.
You're welcome.
I second.
Thank you.
Sure. Second.
All in favor?
Aye.
Aye.
Any board announcements?
This is not a board announcement, but and it's late, but I want to welcome the UIC nursing students for attending this meeting. Thank you for being there and for sticking around, and I'll hope that we can actually see you in person soon. But
I hope
thanks
so
again
too.
for coming.
I hope so too. Thanks for coming. Thanks, Kim, for bringing them. I was just reminding Kim on a note that she used to bring the nurses to the snowball retreat several years ago. It's been almost 20 years now, but she brought several years. At each snowball retreat, we had several of the nursing students, which was great for us and great for the young men and women.
Oh yes, and one of them said to me that I make a motion to adjourn this meeting.
Go ahead, Tom. Make a motion.
So moved.
Thank you very much, Joe, and thank you to all of you for all your hard work on the part of mental health issues in the community. Appreciate it very much. This is Kim, their instructor.
Thanks, Kim. So who seconded it? Oh, you seconded the motion. So, hey, we're done. We adjourned. See you next month, hopefully in person.
Everybody stay well.
That's the plan. That's the plan. You take care of yourselves, okay?
Okay.
Good night.
Good night.
Thank you.
Thank you.